45 years ago, in 1978, psychiatrist Stephen Bergman published his novel, The House of God, written under his pen name, Samuel Shem. The cover has evolved with multiple renditions over the years, with well over 2 million copies in print since 1978. The novel follows a group of brand new doctors, interns, over the course of their first year internship caring for patients in a large urban hospital that the author refers to as the House of God, a fictitious version of Harvard's Beth Israel Hospital, where Dr. Bergman actually did his internship. Through the narrative of the book's main character, Dr. Roy Bash, the story details the author's account of long, painful nights without sleep amidst a myriad of ill, injured, and often dying patients, and the struggle to deal with the pain, the isolation, and at times personal failures and self-doubt that every doctor experiences in some form or fashion over the course of his or her training. The House of God is a fictionalized but realistic account of how doctors have been trained throughout the 20th century to recognize illness and learn the art of medicine through mind-numbing hours of immersion in hospitals across the country. Through most of the 20th century, up until the late 1990s, most doctors in training worked well over 100 hours per week in the hospital for years at a time, caring for patients and learning the necessary skills to do so. The first chapter of the book finds Roy and his girlfriend Barry vacationing in France, as Roy tries to put distance between an exhausting and demanding year and suppress the memory of all that his internship entailed. But to Barry's frustration, Roy's attention keeps drifting back to the hospital, back to the House of God, back to the pathology, to the pain, to suffering, and to the crushing patient experiences that he just can't seem to get out of his head. And despite all the beauty of France that surrounds him in the moment, Roy finds himself subconsciously diagnosing disorders in people who pass his way. Disorders they may not even know that they have, because Roy now sees in others what people often can't see in themselves, and he can no longer separate the human beings he sees around him from the pathology he knows may be progressing within them. I am Roy Bash, and so is every doctor who's ever done an internship or residency in a hospital over the last century. The immersion of medical training changes people, in many ways for the better, and in some ways possibly for the worse. But from a purely diagnostic standpoint, most doctors come out the other side of medical training with a new set of eyes and intuition honed by encounters with multiple hundreds, if not thousands, of patients over their years in training. I was reminded of this on a recent trip to a coastal vacation destination. As we strolled and watched other tourists in this seaside town as they weaved their way in and out of the local shops, what I noticed most were so many overweight 50 and 60 plus aged men walking with their wives. But it wasn't just excess weight that I saw. It was an awareness of what I knew possibly was going on as well. Fat surrounding the abdominal organs, fatty infiltration of the liver, elevated blood pressure, type 2 diabetes. Many of them were wearing shorts, and I could see the swelling of their ankles, something that we call ankle edema. I saw darkening of the skin of the lower legs from chronic fluid retention and leg swelling. And though I obviously couldn't see into their bloodstream and know what was going on at that level, I anticipated what I might see in their lab work if I met these people in the ER. The things that I see in similar patients during every single ER shift that I work: elevated blood glucose, abnormal kidney numbers, elevated liver enzymes, specifically ALT and AST. Their blood pressure would likely be higher than normal, and if we were to get a CT scan of the abdomen, fatty infiltration of the liver would be easy to identify. And the people I saw weren't outliers. They were the majority, a reflective microcosm of our society at large. As we strolled about this small town and perused the outdoor cafes and restaurants, I saw plates piled high with French fries, oversized pizzas, hamburgers, large baskets of bread, enormous plates of nachos, large bowls of pasta, and oversized sodas. And I realized it wasn't just because I was a tourist in a tourist destination that I was seeing this. This is how so many Americans eat all over the country 24/7, week after week and year after year. The food environment in which we now live is responsible for so much pathology. But the problem is most people aren't aware of the progression of that pathology, often until problems begin to arise. It flies under the radar for most people. They don't see what this chronic, incessant excess of calories is doing to their bodies over time. But we don't have to be at the mercy of our food environment. We can do things to change the way that we interact with it. But one of the first things you can do to take control of your health is simply to open your eyes and take a good, hard look at you. So here are 7 physical findings findings that I want you to be on the lookout for. I want you to be a little like Dr. Roy Bash from the House of God, but in the sense that you're taking a close look at your own situation. Number one, look in the mirror for skin tags, or have a spouse or a family member, someone with whom you're comfortable, look for them. They can often be seen around the neck, in the armpits, the groin area, and their presence may be related to excess weight, insulin resistance, and poor glucose control, or even type 2 diabetes. Number two, look for darkening of skin over the back and the sides of the neck, the skin creases of the arms and legs, as well as the knees and the elbows. This darkening of skin is something called acanthosis nigricans, and it's also associated with the progression of excess weight and insulin resistance, and it can be an early finding on the path to a type 2 diabetes diagnosis. Number three, waist to hip ratio. This is simply a measurement of your waistline divided by a measurement of your hips. A ratio over 0.95 for men and over 0.80 for women are both considered unhealthy and typically indicate the need for weight loss and possibly indicates the presence of too much intra-abdominal fat. A high waist to hip ratio may increase risk for type 2 diabetes, heart disease, and stroke, so addressing this is really very important. Number four, next I want you to be aware of ankle swelling. Ankle swelling can occur because of excess weight, high blood pressure, cardiac dysfunction, or incompetent veins, resulting in poor blood return from the legs back to the central circulation and the heart. And if persistent long enough, ankle swelling can lead to darkening of the skin of the lower legs and to the development of sores and soft tissue ulcers, which may be difficult to heal. Number five, excess urination. Ask yourself if you're urinating more frequently than usual, or if you're waking up more often during the night with the urge to urinate. Number six, increased thirst. Are you thirstier than usual? A realization that you're urinating more frequently, along with increased thirst, may be a warning sign that your blood glucose is consistently running high and you're losing body water through excess urination. Number seven, excess fatigue. Fatigue is something that many people experience for a variety of different reasons, which may or may not indicate a primary health problem. But if you find that you're more exhausted than usual and have any of the preceding findings, it may be time for a checkup and some blood work. All these physical findings are often closely associated with excess weight, as well as the presence of high blood pressure, elevated blood glucose, and elevated A1C. If you recognize any of these findings, or you simply know that you're not at a healthy weight, go see your doctor to discuss what you found on your own self-examination. Like Dr. Roy Bash in the House of God, once you learn to look for these physical findings in yourself, you'll be surprised how often you notice them in the people all around you as well. Be proactive about your own health and do what you need to do to turn things around if any of these findings apply to you. Hopefully your friends and family will be watching as you head in a healthier direction, and they'll find the motivation and inspiration from you to do the same. Thanks for watching, and I'll see you in the next video.